Major Depressive Disorder, MDD. Major Depressive Disorder, often just called depression, is like having a cloud that follows you everywhere you go. It's not just feeling sad, it's like being unable to see the sunshine even on a bright day. People with depression might feel really sad for weeks or even longer. They might not enjoy things they used to love, like playing a game or hanging out with friends. Also, they might feel really tired all the time, have trouble sleeping, or sleep too much. Eating might change too, some might eat a lot more, or not want to eat at all. Sometimes, they feel like they're worthless or feel guilty without a big reason. Thinking can become really hard, and making decisions can feel like trying to swim through mud. It's important to know that depression is not just a bad mood that you can snap out of. It's a real health condition and it's not anybody's fault for feeling this way. Doctors can help treat it with talking therapies, medicine, or sometimes both. It's like if you had a broken leg, you'd wear a cast, so if your mood is broken, there's help to fix that too. Generalized Anxiety Disorder, GAD. Imagine you have an alarm system in your brain, meant to alert you when something might be wrong. But if you have generalized anxiety disorder, it's like this alarm system goes off all the time, even when there's no real danger. It makes you worry a lot about different things like school, health, or even things that haven't happened yet, like wondering if a tree might fall on your house even on a calm day. People with GAD feel anxious most days and find it hard to stop worrying. It's not just feeling nervous about a test or a big game, it's like feeling worried all the time about lots of things, so much that it makes it hard to focus in school or to relax. They might also feel really restless or have trouble sitting still. They might be easily tired, have trouble sleeping, or even feel like their muscles are always tense, like they're ready to run a race at any moment. It's tough because this kind of worry isn't something that can be easily controlled or turned off. But the good news is, there are ways to manage it. Doctors can help with therapies that teach you how to calm your mind, and sometimes medicine can help too. Click subscribe to this channel to get more topics you love. Bipolar Disorder. Bipolar disorder is like being on an emotional roller coaster that you can't control. It involves extreme mood swings. Sometimes, you feel super happy and energetic, more than usual. This is called a manic episode. During this time, you might talk a lot, sleep very little, and feel like you can do anything. It's like having too much energy and not enough places to use it. Then, there are times when you swing to the opposite mood, feeling very sad and low, which is called a depressive episode. During these times, you might feel very tired, sad, and not interested in anything. It's like the energy has been sucked out of you. These mood swings can affect how you think, behave, and handle daily life, making things like school, relationships, and hobbies really challenging. It's not just being moody, these changes are intense and can happen over weeks or months. Treatment usually involves talking to a mental health professional and sometimes taking medication to help stabilize these mood swings. It's a bit like having a guide and tools to help keep the roller coaster on a more even track. Schizophrenia. Schizophrenia is a complex brain disorder. It's like your brain gets a bunch of mixed up signals that affect how you see and understand the world. People with schizophrenia might hear voices that others don't hear or see things that others don't see. These are called hallucinations. They might also believe things that aren't true, known as delusions, like thinking they're being followed when they're not. Besides these experiences, they might find it hard to organize their thoughts or make plans. Sometimes they may speak in a way that's hard for others to understand or seem like they're not showing their emotions. Schizophrenia can make everyday activities challenging because it's tough to figure out what's real and what's not. This can make school, work, and relationships really difficult. Treatment often involves medication to help reduce the symptoms and therapy to learn ways to cope with the condition. It's kind of like having a team to help tune the radio when it's not working properly, making sure the signals come in clear and strong. Post-traumatic stress disorder, PTSD. Imagine if your mind kept replaying a scary movie that you didn't like, over and over, especially when you didn't want to watch it. That's a bit like what happens with post-traumatic stress disorder, or PTSD. This can happen to someone who has seen or experienced something very scary or upsetting. With PTSD, these memories keep coming back when you don't expect them. They can come as nightmares when you're sleeping or as flashbacks during the day. These aren't just ordinary memories, they feel so real it's as if you are living through that scary moment again. This can make you feel very anxious or on edge all the time. You might also try very hard to avoid anything that reminds you of that bad experience. People with PTSD might feel jumpy, have trouble sleeping, or find they get angry very easily. It's like their mind is always on alert, trying to protect them from danger. Treatment for PTSD includes talking to a therapist who can help work through these memories in a safe way, and sometimes medication can help with the anxiety and stress. It's like having a guide who helps you through a very dark forest until you can see the path clearly again. Obsessive-Compulsive Disorder, OCD. Imagine your brain gets stuck on a certain thought or worry, like wondering if you forgot to lock the door, and no matter how many times you check, you can't stop thinking about it. That's a bit like obsessive-compulsive disorder, or OCD. People with OCD have obsessions, which are these stuck thoughts that keep coming back, and compulsions, which are actions they feel they must do over and over to try to make the thoughts go away. For example, someone might wash their hands many times to try to get rid of fears about germs, or they might keep checking the stove to make sure it's off because they're scared of starting a fire. These actions can take up a lot of time and make normal daily activities hard to do. It's not just being a perfectionist or liking things a certain way, it's feelings and actions that you can't control, even if you know they don't make sense. Therapy, especially a type called cognitive behavioral therapy, can be really helpful. Sometimes, medicine can also help to lower the anxiety that comes with OCD. It's like getting tools to fix a machine that keeps getting stuck. Panic disorder. Imagine you're walking down the street, and suddenly, out of nowhere, you feel like you're in huge danger. Your heart starts racing, you might start sweating or shaking, and you feel like you can't breathe properly. This intense fear is what a panic attack can feel like. Panic disorder is when someone has repeated panic attacks and worries a lot about having more of them, or changes their behavior to avoid having another attack. These panic attacks can happen without any clear reason and can be very scary. It's not just feeling a bit nervous, it's an overwhelming fear that can make you feel like you're losing control or even having a heart attack. People with panic disorder might start to avoid places or situations where they've had an attack before, like crowded places or being outside their home alone. This can really interfere with their daily life. Treatment usually involves therapy, which can help people learn how to handle and reduce their fear. Medication might also be used to help control the symptoms, making the panic attacks less frequent or severe. It's like learning to calm the storm inside your mind. Social anxiety disorder, social phobia. Social anxiety disorder is more than just being shy. It's when you feel really scared and worried about everyday social situations because you fear that people will judge you or that you will embarrass yourself. For example, speaking in class, meeting new people, or even eating in front of others can feel really daunting. People with social anxiety often worry for days or weeks leading up to a social event. They might feel very nervous, have a rapid heart rate, or feel nauseous just thinking about being around others. This fear can make them want to avoid social situations altogether, which can make it hard to make friends, go to school, or join in on fun activities. The good news is that social anxiety can be treated. Therapy, especially types that focus on behavior, can help a lot. It teaches ways to handle these fears and helps people slowly feel more comfortable around others. Sometimes, medication can also help reduce the anxiety. Borderline personality disorder, BPD. Borderline personality disorder, or BPD, involves having really intense emotions that can change very quickly. It can feel like being on an emotional seesaw where one moment you feel okay, and then something small can make you feel extremely sad or very angry. People with BPD might have a hard time having stable relationships. They can feel very close to someone one moment and then suddenly feel like that person doesn't care about them at all. This can lead to impulsive actions and intense arguments. Sometimes, they might feel like they don't have a strong sense of who they are, which can make them feel empty or unsure about their life. BPD can be tough both for the person who has it and for their friends and family. However, there is therapy that can help a lot. Therapy can teach better ways to handle emotions and improve relationships. It's about building a toolkit to manage the highs and lows in a healthier way. Attention Deficit/Hyperactivity Disorder, ADHD. Attention Deficit/Hyperactivity Disorder, commonly known as ADHD, is like having a brain that's always looking for new things to pay attention to. It's not just about being hyper or moving around a lot. It also means having trouble focusing, staying organized, and sometimes acting without thinking about the consequences. For someone with ADHD, doing things like finishing homework, listening to a long lesson at school, or even following a conversation can be really hard. Their mind might jump from one thought to another very quickly, or they might get bored very easily and look for something more exciting to do. People with ADHD might also act impulsively, which means doing things without thinking it through first, like blurting out an answer in class without raising their hand. They might also feel restless and find it hard to sit still, needing to tap their feet, fidget, or just get up and move around. The good news is that ADHD can be managed well with the right kind of help. This usually includes things like therapy, which can teach strategies for staying focused and organized. Sometimes, medication is also used to help calm the brain's need for constant activity. It's like getting a remote control for a TV that's always switching channels on its own. Eating disorders, like anorexia and bulimia. Eating disorders are serious and complex conditions that involve an unhealthy focus on eating, body weight, and shape. Anorexia nervosa, for example, is when someone tries to keep their weight as low as possible by not eating enough food, excessively exercising, or both. They might see themselves as overweight even if they are dangerously underweight. Bulimia nervosa involves periods of eating a lot of food in a very short time, binging, followed by trying to get rid of the food or calories. This might be done by vomiting, using laxatives, or exercising a lot. It's like being in a painful cycle that feels impossible to break. These disorders are not really about food but more about feelings and how people see themselves and their bodies. They can be very harmful to the body and can make daily life very difficult. Treatment often involves a team of professionals, including doctors, nutritionists, and therapists. They work together to help someone find a healthier way to deal with food and their emotions. It's about healing the mind and the body together, helping someone learn to see themselves and their health in a new light. Generalized Anxiety Disorder, GAD. Generalized Anxiety Disorder, or GAD, involves excessive and uncontrollable worry about everyday things, ranging from work and health to minor concerns like chores or appointments. It's as though the brain's worry switch is stuck in the on position. People with GAD find it hard to control their anxiety and may worry much more than the situation warrants. Symptoms of GAD include feeling restless or on edge, being easily fatigued, having difficulty concentrating, being irritable, experiencing muscle tension, and having trouble with sleep. These symptoms can make daily life feel overwhelming and exhausting. Treatment for GAD typically involves psychotherapy, particularly cognitive behavioral therapy, CBT, which helps individuals change their thought patterns and reduce anxiety. Medications, such as antidepressants and anti-anxiety drugs, may also be used to help manage symptoms. It's about learning tools and techniques to turn down the volume of worry and regain control over one's thoughts and feelings. Autism Spectrum Disorder, ASD. Autism Spectrum Disorder, ASD, is a developmental disorder that affects communication and behavior. Although autism can be diagnosed at any age, it is said to be a developmental disorder because symptoms generally appear in the first 2 years of life. People with ASD often have difficulties with communication, display restricted interests, and exhibit repetitive behaviors. The spectrum in ASD means that each person with autism has a distinct set of strengths and challenges. Some might require significant support in their daily lives, while others may need less support and, in some cases, live entirely independently. The approaches to support ASD include behavioral therapy, speech and occupational therapies, and sometimes medications to manage related conditions like sleep disturbances and anxiety. Education and training tailored to individual needs can significantly enhance an individual's quality of life. It's about providing the right environment and tools to help each person with ASD thrive in their own unique way. Dissociative disorders. Dissociative disorders involve problems with memory, identity, emotion, perception, and a sense of self. Dissociative symptoms can potentially disrupt every area of psychological functioning. This group of disorders includes dissociative amnesia, dissociative identity disorder, formerly known as multiple personality disorder, and depersonalization/derealization disorder. For example, someone with dissociative identity disorder may feel like they have 2 or more distinct identities or personalities, each with their own way of perceiving and interacting with the world. Depersonalization/derealization disorder involves a persistent or recurrent feeling of being detached from one's body or thoughts, depersonalization, or a sense of unreality about one's surroundings, derealization. Treatment for dissociative disorders often involves psychotherapy, with techniques designed to integrate the different aspects of identity, improve symptoms, and coordinate dissociative parts of the personality. This therapy can be long-term and complex but is crucial in helping individuals live more cohesive and stable lives. Schizophrenia. Schizophrenia is a severe mental disorder affecting thought processes, leading to hallucinations, delusions, and disorganized thinking. Treatment typically involves medications and psychotherapy to manage symptoms and improve quality of life. Early diagnosis and treatment are crucial for better outcomes.